ASD stands for Autism Spectrum Disorder and is a neurodevelopmental condition that has negative effects on social interaction, communication, and behavior. The CDC reports that 1 in 54 American children has autism. Although scientists have yet to pinpoint a single cause of autism, they have found a number of risk factors. We'll look at some of the most prevalent causes of autism in kids and how to help them. 1. Genetics. To a large extent, autistic traits are inherited. Children with a history of autism in their family are at a higher risk of being diagnosed with the disorder themselves, and studies have implicated multiple genes in its onset. A higher prevalence of autism in offspring has been linked to the parental history of the disorder, according to studies. 2. Brain development. Studies have demonstrated that autistic children's brains grow in a unique way compared to the brains of typically developing youngsters. The brain size of autistic children can range from normal to abnormally large. In addition, abnormalities in brain structure and function may have an impact on how some autistic children process information. 3. Environmental factors have been speculated to play a part in autism's onset. An increased incidence of autism has been associated with exposure to certain poisons and chemicals, such as lead, during pregnancy or early life. Premature birth and low birth weight are two more environmental factors linked to an increased incidence of autism. 4. In addition to environmental influences, prenatal and perinatal conditions, including maternal stress, malnutrition, and infections, may have a role in the emergence of autism spectrum disorder. Studies have revealed that these elements can have an effect on brain maturation and thus raise the probability of autism. 5. Autism has been linked to a number of medical diseases, including Fragile X syndrome, tuberous sclerosis, and Rett syndrome. Autism-like behaviors may result from impaired brain development caused by certain disorders. The precise reason for autism's prevalence is still unknown, but studies have pointed to a number of risk factors. Some examples of such variables are heredity, brain maturation, environment, prenatal and postnatal circumstances, and illness. Knowing these factors can help parents and caregivers intervene earlier if they fear their child has autism. Children with autism can live happy, productive lives if they are diagnosed and treated early.